Here.
Right. So we basically look at a couple of things today just before we start. So as you know, most of us, we've been looking at studying the health and social care sector unit. This unit has 3 learning outcomes. So we have covered learning outcome 1 and learning outcome 2. Last week after the bank holiday weekend, Tuesday we covered learning outcome 2. And this is looking into the details of, the legislation, which is law and legislation, which is important and structured around health and social care sector in particular. So we looked at lots of different laws and legislation which are key to bringing our understanding on this side of things to a certain expected level. So we looked at the Care Act of 2014. We also looked at the Mental Health Care Act. We looked at the NHS Act. We looked at the Food and Safety Act. We looked at the Human Rights Act, the Manual, Handling and Operations and Regulations Act. We looked at a bit of Safeguarding and Safeguarding Act. We also, went into details of looking at, the aspects of understanding data protection and why it is important in particular when we consider 6 C's of the, person-centered approach, and also the integrated care options that we look at in particular, when we look at legislation. So there were bits and pieces that we covered, which primarily helped us understand, the current legislation. And this legislation or laws, as we say, are then taken up by key regulators like CQC, NICE, you look at the King's Fund, you look at MHRA, Public Health England, lots of different, bodies, which are semi-autonomous bodies, some are charities, some are regulators. They then pick up these laws, acts, and legislation, which are introduced by the Parliament. And then the Department of Health, when we look at these in total, what tends to happen is that these agencies and regulators essentially create what are called policies and procedures, guidelines, which are then issued. So what I would suggest is, if you're not asking questions, if you mute yourself, that will be helpful, and keep the background noise to the minimum. And then what tends to happen is, when we look at these laws and legislations, these regulators in particular, the agencies, pick up these laws and then create what are called guidelines. These guidelines are then translated into policies and procedures, which are, some of them are guidelines, as I say the word guideline, and some of them tend to be procedures which have to be followed because they have to be followed from a point of view of compliance and regulation. Then when we also looked at in the presentation that we covered, we also looked at some of the assessment criteria predominantly for learning outcome 2. And if I look at bringing your attention quickly towards the presentation that we went through, which is available on Moodle, and also let me just get everybody in, and also from a point of view of looking at the detailings, there were some handouts which I have uploaded for the key acts that I mentioned earlier. And these are now available, or at least were available from last week on the Moodle. So you should be able to see the revised version of the presentation, the handouts that I've specifically created for the important acts and legislations that you need to be aware of. And last but not the least, the care, 6 C's of care. And lastly, the relationship between healthcare values and care values. Now, there are lots of professional agencies in particular, and there are a few that I put up on the slide, which are looking at, incorporating these legislations into what are called compliances and guidelines, and then they are circulated to relevant setups within the health and social care sector, like a care home, like a hospital, like an A&E, like a surgery, and they are then followed, for the purposes of ensuring that people, when they are getting care and when they are being looked after and provided services, are being done in a way which meets the guidelines and the regulations set by CQC and some of the other regulators under the Department of Health. Now, today, what we are going to do is basically look at studying learning outcome 3. So just very briefly take you back again to the unit spec. Now, in the unit spec in Learning Outcome 3, we are looking at focusing on what is called the importance of multidisciplinary working in health and social care. Now, this is a single most important aspect of, what we are going to study in this unit, because of the fact that when we talk about multidisciplinary working, what do we mean by multidisciplinary working? Why is it important and integral part of this particular sector when we talk about health and social care is something we need to look into a bit more detail. There are a couple of assessment criteria that we will discuss. They will include going into the benefits and challenges of how things work in partnership within this sector. We'll be looking at how the health and social care sector and the social services side of the sector essentially works together within the remit of the health and social care or the Department of Health, and then delivers services to the members of public. We look at some of the best examples and practices of how a health and social care setting should be. That means how a care home should be set up, or what are the key important criteria which are to be looked at. And then last but not the least, we look at some of the assessment criteria on the merit and distinction side, which talk about the role of learning and development, which is more or less related to 1M1, because here we developed a personal development plan and understood what is the importance of training and development. And in this part, what we are going to be looking at, dwelling on that, and then basically covering the role of multidisciplinary teams and how they inform learning and development to different people or practitioners within this sector. And then the distinction criteria talks about how do we assess, consequences if services are not provided, or if partnerships break down, or if, communication between suppliers, contractors, or, different organizations and agencies breaks down, then what are the detrimental effects of this? Or, what could be the negative effects of these, which could affect, the delivery of these services, to the members of public. Now, what we will do is we'll start off with, some of the key understanding on multidisciplinary teams and what is partnership, and, how do we look at partnerships. So let me switch you over to a presentation, and this is going to be helping us to discuss, the Learning Outcome 3. So if you have any questions at any given point in time during the course of our discussions, feel free to, put them onto the chat route. You can ask me questions as well by raising a hand. But in general, the idea would be to have a discussion on this particular topic so that, everyone understands clearly what is the role and importance of multidisciplinary working, specifically within the health and social care sector. Now, if I look at talking about, if I just briefly look at talking about, say, for example, if I introduce a quick slide here and call it, say, key terminology. And the reason I would want to do is I want to look at, what is multidisciplinary. When I say, multidisciplinary working, what does it mean in general? So when we talk about multidisciplinary working, the word multi and disciplinary. Multi means many. And then when we say disciplinary, disciplinary means that we are looking at people from different disciplines. That means from different areas of work coming together to be able to offer services to the individuals. Now, this particular part, in one term that you need to be familiar with in the health and social care sector, is called MDT, multidisciplinary teams. Now, when we look at nurses, healthcare workers, assistants, doctors, GPs, consultants, working together in a hospital. For example, if you just wear the hat of a thinker right now, and just imagine that you are visiting a hospital. If you've gone to the Manchester Infirmary, you've gone to the North Manchester Hospital, or you've gone to Wythenshawe, any of the hospitals if you've ever been to, just think of when you enter from the reception, you are looking at different sets of people working. There'll be somebody in security, there'll be somebody at the reception, There'll be, when you go up towards the wards or maybe a particular section in the hospital, you generally meet some nurses. You'll probably be hitting a buzzer button to be able to get in. You meet a nurse or doctor, or you will see some patients. You'll see different types of workers working within the hospital. Somebody's doing cleaning, janitors, somebody's doing away with some of the stuff in terms of changing the linen, bedding. What is happening in this case? You're seeing a lot of people work together in a particular setup, and they are all related to doing their roles and responsibilities, but they might not be directly providing you care. Care might be provided by healthcare workers, healthcare assistants, nurses, or paramedics, for example, or GPs or consultants in the hospital. But there are a group of people who are working towards making sure the hospital is clean and tidy, it's infection free, all the services and things are working, whether it's the air conditioning, lifts, whatever it is. Now, what you see is a lot of different type of people working within under one particular roof. Now, if I have to group them together, I would probably group them together and say they are a part of a team. They are a part of the administration team. They are a part of the clinical team. They are a part of the nurses team, whatever it is. And when we look at that, in terms of taking a group of people and putting them together into a team, and that group of health and social care staff who are working within different departments and setups within the hospital, which could be GPs, social workers, nurses, whatever it is, they are all working together to make decisions which are going to help in the treatment of individual patients and the users who have come in to receive any sort of treatment. And this, when it is being done as a part of a team, as a part of a teamwork, or as a group of individuals working together to help solve problems, help offer solutions, help, treatments to patients under the remit of health and social care, then we will term them as what are called MDTs, or multidisciplinary teams. So these are a group of individuals which are working in different disciplines, different areas, and they are collaborating on one particular aspect, one singular goal, that is to provide treatment to individual patients. And they are using their knowledge, their skills, their various experiences, best practices to be able to offer the best possible solution to the patients who have come in to receive treatment. Now, what is the main goal? The main goal here is to ensure that the services being provided are integrated, meeting the requirements and care which the patient needs. And last but not the least, they are ensuring that they are working together to seamlessly provide this model of care to the patients so that they can actually get better. And this holistic and collaborative approach of people working together in teams within the health and social care sector is nothing but what is called multidisciplinary team working. So this is something that you need to be very clearly, very clearly aware of. And this is what I would say what a multidisciplinary team is. Now, when we say multidisciplinary team and we talk about multidisciplinary working, what does this constitute? If I say multidisciplinary team working, that means people from different backgrounds, different expertise, different sets in terms of decision making and authority to be able to make decision making, people having access to different resources and communication mediums come together to be able to offer services to a group of patients or a patient or service users. So here, the benefits of working together under a team in providing these services tends to come from the various expertise which people have when the team is formed. So there could be people who come from the medicine background, from the engineering background, from psychology background, from physiology background, from phlebotomy background, people who do tests. So that what does that mean? We are looking at different forms of different types of people who are coming together with different expertise to be able to work together under one banner and then provide these services. They could be termed as practitioners. And when I say practitioner, I'm talking about nurses, doctors, pharmacists, psychologists, physical therapists. I'm talking about nutritionists. I'm talking about nurses, healthcare workers. And all of these people are coming together to provide care, to the patients or meeting the requirements of what care planning has to be done in terms of a care plan, and that being provided to the patients. Now, when we also talk about working, we also talk about what is called partnership working. The reason, when we talk about partnership and we talk about partnership working is also because of the fact that there are different types of people. When they come together, they work in a team. And when we say partnership working, and partnership working in health and social care in particular, we are referring to a fact that, there are people from diverse backgrounds which are coming together, and they are going to be working as an effective team. And this effective team is going to be looking at providing all different types of services. These services would include healthcare services, mental health care services, clinical services, say, for example, somebody undergoing operations, then different people from different sets of teams will be coming together to basically work together as partners. So if you imagine an operation theater, or if you imagine, say, for example, the hospital working, there are parties which are working within the hospital. There are contractors which are working outside the hospital, or different companies which are providing support in these services. And this is where partnership working refers to a collaborative approach between different organizations, agencies, professionals, and stakeholders who are working tirelessly to deliver healthcare and social support services to patients or members of public. Now, it could also involve, when we look at a hospital setup, it could also involve joining in a lot of forces, which could be looking at sharing resources. So, for example, if you look at the Vidyanshaw Hospital, that is also a center of, it's also a university center for University of Manchester. So here, the university also trains and works in partnership with Vidyanshaw and the trust which runs the Vidyanshaw Hospital. Because what they would look at doing is they would be looking at benefiting from the academic and the research facilities which the hospital has. And also at some point in time, when these young doctors, nurses, paramedics, or different practitioners actually end up completing their courses, at some point in time when they start working, they are very well familiar with the hospital and its hospital setup. And their aim of ensuring this partnership, I don't know how many of you have seen, but when we look at Vidyanshaw Hospital, let me try and see if I can bring up the website. And this particular hospital, it is called the Manchester University NHS Foundation Trust, MFT in short. And if I take you onto the website, they are working essentially in partnership with the University of Manchester to be able to provide the basic services that we need, to the members of public. And as you can see, it says Manchester University NHS Foundation Trust. Now, the reason of this partnership is to look at, collaboration, to look at making sure that staff which is being trained is understanding the practical aspects of, the case of delivery of services to the patients. This is a collaboration between, say, some part of it being private and some part of it being public partnership, simply because hospital and care providers, they need to work together. There could be agencies which are supplying goods, materials, resources to the hospital, but they need to work in partnership to be able to access and provide this quality care which is required. In some cases, this is partnership because it requires also to optimize resources, financial resources, to achieve better outcomes. And also looking at, in some cases, when we look at hospital and research and university, and in this case, research, the benefits of partnership tend to be that it allows for improved coordination, better access to services, and obviously keeps the services at the cutting edge because research is currently being done. So if I just show you the homepage itself, you are able to get a sense of how partnership is working. Research and innovation, you look at volunteering, you look at charity, you look at the hospital itself, the website, and the university. So there are 4 or 5 different organizations that we can see which are already cooperating in some sort of a partnership to be able to deliver these services to the members of public. So there are charities and fundraising organizations working within the hospital. There are people who are volunteering, to provide services to members of public in terms of, or maybe provide additional support. There's research and innovation or research and development, which is happening with the University of Manchester, students or young doctors or, trainee doctors working. And obviously there are bits and pieces which are highlighted on the website. And as you can see, the cardiovascular research hub and the lungs, related, pulmonary and respiratory related, research is predominantly done in the Wythenshawe Hospital in collaboration with the University of Manchester. So this highlights what we want to see is the role of, partnership, essentially, when we talk about, looking at multidisciplinary teams and the role of partnership. Now, this, I hope, gives you some bit of an understanding in terms of what is that we are going to be looking at in this learning outcome. So we are looking at focusing on multidisciplinary teams. When we talk about MDTs involve partnership. And this concept of partnership was introduced, in the NHS or the National Health Service by the then Labour government in 1997. And then Tony Blair, who was the Prime Minister then, he established this concept of public-private partnership, which is now, quite instrumental in helping and delivering services within the health and social care sector. So when we talk about public-private partnership, we are looking at interagency collaboration between private companies and the National Health Service. And this collaboration between public sector organization and some of the private entities, like hospitals, other care providers, Bupa, for example, Spiral, for example, they are being done to leverage each other's strengths and resources. So sometimes what happens is, an example of this that I would give you is that because of COVID and because of the lockdowns and other things, there is a lot of backlog in the NHS for people waiting to get cancer treatment or, any sort of, say, knee replacement, hip replacement treatments. Now here, the NHS is looking at working very closely with private players to be able to offer these services to the patients who have been put on the waiting list. Now, that is where we see public-private partnership. The payments of it, the financial side of it still is being covered by the NHS, but the operational or the operative surgery is happening with patients who cannot wait or are having critical illnesses, are being then referred to private providers wherein the resources are available and they are able to get the service in terms of, the treatment from there without having to be waiting for months, weeks and months on the waiting list. So here it is helping to capitalize on strength of private sector, wherein they have resources and NHS is able to use these resources to be able to help provide faster turnaround or services to the, the members of public. In this case, as an example, and I would mention is looking at, say, for example, if somebody's been waiting for a year, 2 years for hip replacement, knee replacement, or, some of the critical operations that they need to look at for the purposes of, getting better. Now, when we look at partnership, there are lots of other, reasons why partnership as a concept was established. And this was established because it allowed, the NHS, the National Health Service, to focus on some of the clear outcomes which are required to be able to be achieved. Things like quality of care, involvement of service users as far as family, communities, and, let's say private players are concerned, which could then come in and be a part and parcel of, planning, delivery, and evaluation of some of these services from time to time, so that if there are any gap areas, if there are any slippages, then these other bodies or, participation from different other teams allows these weaknesses or, gap areas to be picked up, highlighted. And that is where one of the benefits of, public-private partnership also can be clearly seen. Now, when we talk about, one of the other things that I want to look at is what are the challenges, which are typically, which can be faced when we look at, working, say, for example, in partnership. So when we talk about challenges of working in partnership, in particular, so if I put it this way, that when we talk about challenges, of what could be the challenges, first of all, the challenges could be, when we hear the news that NHS is cash strapped, that means finances, in health and social care, or probably, in the NHS, when we talk about and when we hear this directly, are not there. So NHS sometimes has to go back and then, look at, for example, getting additional resources in terms of finances, additional resources in terms of, during COVID, for example, there were new hospitals or makeshift hospitals which were set up because we required increased bed capacity to be able to, hospital needed increased bed capacity to be able to take more patients in, which were having problems in terms of breathing, and ventilators were required. So that is where you see that private-public partnership, essentially worked. And this meant that at some stage, when we were looking at some of these challenges of arranging, for example, the ventilators or additional beds, that was being catered to by government legislation, wherein we see lots of makeshift hospitals which were created essentially, in London, in Manchester, in Birmingham, in Leeds, and they were done with the help of, different sets of people working in the private sector. And when we look at these challenges in particular that we discuss in terms of partnership, these challenges could be in collaborating, or the challenges could be while integrating or implementing the services which have to be delivered to, patients. So these challenges can be financial, they can be resource, shortage of resources, shortage of finances. There could be communication challenges sometimes in terms of information sharing. When I say communication challenges, what I mean by that is you're looking at information sharing. How much of information about the patients can be shared with the private sector? Now, we don't want if you are having a private medical insurance, you don't want your insurance premium to go up if this information which the NHS holds is made available to private insurance providers, then your insurance premium might go up. And that is where the information sharing, bottlenecks come in. And there could be, some challenges on this side. You could have challenges which could be on the local, national, regional level. So I would say national level, there are bits and pieces which started off with COVID. Then these policies and plans which were introduced were adopted locally by the devolved governments, and then they were regionally adopted, to offer these services or offer, services, or there were restrictions which were being placed on movement of people, and, obviously lockdowns and other things. And that was to control the flow of and spread of virus. So in some cases, sometimes you had these differences between the things which were being, said from number 10 Downing Street, and then you had different implementations of these happening in Scotland, Ireland, Wales, and Northern Ireland, is because there were national or local, I would say, or regional differences in the way these policies, regulations, and, let's say the structure to be able to deal with COVID as a pandemic were being put into place. So sometimes you look at these as challenges, which could be communication challenges, which could be challenges because of how the implementation of policies need to be done at the local, regional, and national level. And last but not the least, we look at financial and, resource challenges, which could be financial in terms of pure money, resources being financial money being available, or, let's say resources like infrastructure being available, which is like the construction of, hospitals, which was done in order to increase bed capacity, the, import of ventilators, or government created a policy that there could be no import of ventilators, which would happen from the UK because of pandemic. And the country itself required ventilators. So some of the manufacturers were asked not to import, and a ban was put in. And when we look at data sharing and information governance, we look at some of these as big challenges which come up predominantly when we see partnership and multidisciplinary team working happening within the National Health Service. Now, one last thing, which I would also put it this way, that when we talk about, say, for example, what are barriers, to partnership working? Now, this is something which is also to be looked at apart from, let's say when we talk about, challenges, when we look at barriers to, working in terms of partnership working within the National Health Service in particular, or in the health and social care sector in particular, we need to talk about and consider why these barriers, get formed. Why do we have, essentially barriers in working in, health and social care sector? So when we talk about barriers in health and social care sector, any idea, anybody, in terms of what could be these barriers? Before we get into partnership working barriers, any idea in terms of, in general, what could be the barriers in health and social care when we talk about, the sector in general? So give you a simple example just to put this into context. Sometimes if you go to the bank, and if you go to the bank, if you see a glass screen in the middle between you and the teller, there is a hearing in loop. So people who have a disability on, say, for example, hearing, can actually put a microphone in, or essentially because of the barrier, the physical barrier, if I talk about very simply the literal example of a physical barrier, because there's a glass between you and the other person, in order to overcome that, I don't need to shout or I don't need to talk quite loudly. What we do is use the technology. So there's a microphone put, and on the other side, there's a speaker. So this could be an example of a physical barrier that we get to see when you go to the bank. And during COVID, this particular thing was quite, literally implemented across all places in all banks in order to spread the, stop the spread of the virus and the infection. So physical barriers tend to be when you introduce physical barriers, like a glass, window or a glass barrier, in order to protect the spread of the virus during COVID in the banks between you and the teller, or you and the bank staff. Now, when we talk about barriers in healthcare, barriers could be physical barriers, could be psychological barriers, cultural barriers, geographical barriers. Cultural barrier, if I'm not a native speaker of English, and if I have to go to the hospital and I don't understand English, but I understand my own language, say, for example, you understand language which is, you struggle with English, and you have a different language that you speak at home, then that could be a communication barrier in terms of language. But if I look at cultural barrier, for example, if you come from a different culture, and in some cases, some cultures, women normally go with their men to the hospital. So most of the talk is done through the husband or the spouse. And, in those cases, that could be a cultural barrier, because that's how the people work, or, have their cultural and their traditions as far as their, background and, their religion is concerned. So you can have different types of barriers. Now, when we talk about barriers in general, and we talk about barriers in partnership, there could be some similarities, but these barriers could be, when I talk about partnership barriers, these barriers could be leading to providing fragmented services in terms of health and social care services to members of public. That means different agencies, departments, they operate independently, but when they are operating independently, they are solely focusing on fulfilling their own objectives and priorities, without having the need for them to look into how they are able to better collaborate and coordinate to be able to provide these services. So when we talk about, these barriers, so for example, if I look at a barrier which, when I say, say in partnership, and I look at, say, for example, in particular, this particular barrier, which could be, by giving you an example, what I would primarily put is that if I do see that when we talk about partnership barriers in health and social care, there could be a barrier which could be simply explained by looking at an example of how communication sometimes breaks down. If patient records, for example, are not updated at the GP surgery, and a patient ends up in A&E or hospital, and they are not able to, say, for example, retrieve his records from the GP surgery, then this could become an information and a communication barrier in order to treat that patient, because they would need to get access to important bits of information like the blood type, the blood group, maybe near dear ones in terms of who's the emergency contact, or maybe look at previous conditions which the patient has had in terms of illnesses. And these would all be available from, say, for example, the records which are available in the GP surgery in respect to that patient. So one example of partnership barrier that we can see is lack of effective communication and information sharing between different organizations. So here, a GP surgery might not have updated the records, and that could be manually updated. And in between, this patient has had an accident, and that is where the records are not up to date as far as somebody when they access it from the National Health Service computing system in the A&E department. And this is because that each organization may have their own aspect of storing information, recording information, and that creates a bit of a fragmented approach. And when it comes to accessing, sharing of this information as a centralized resource, this may lead to having or showing gaps, or maybe in some cases even duplication of information. And that could be, say, for example, barriers when we look at partnership working. It's a simple example. If you look at home, and if there is a bit of work that you want to do, and what you do is you divide that work amongst your kids, two of your kids, and say, okay, you do this part, you do this part, and they both go to their room and they start working on their own, but they don't discuss with each other in terms of how you're coming along, or what is the bit that you have completed, or are you facing any problems. They would just sit idle, in their own bits, in terms of rooms or their own sides, and they will try and come up with the best possible solution without having to collaborate or talk to each other to say, I'm facing this problem, are you facing the same problem? How do we overcome this? Should we take some help? And that bit, if it is not working, is basically showing that there is a communication breakdown. It is basically showing that there is power dynamics. Maybe the elder sibling is not interested in sharing his findings with the younger sibling, so that is power dynamics. So in some cases, these could be issues which you would generally see that prop up when we talk about barriers in partnership working. Is that okay? Any questions on this so far?
No.
Yes, go ahead.
No, I don't have any.
All right, okay. So now when we look at anybody else, if you have any questions, feel free to ask, because what I have done so far is I've given you a bit of a background about the learning outcome in terms of, what the learning outcome covers and how do we look at importance of understanding multidisciplinary team working, and then partnership within multidisciplinary team working, and why partnership and multidisciplinary team working sometimes does not work. And that could be because of barriers which get created, or in some cases challenges which are faced by different teams. And that is where the fragmentation of services and services offered to the members of public can happen. Now, if we get into some of the assessment criteria in terms of benefits and challenges of working in partnership. Now, what are the benefits and challenges? One of the benefits tends to be that care, when it is provided, tends to be holistic. So when you create a clear plan, when you talk about obviously creating a care plan for the patients, in terms of if they're receiving any sort of a treatment, and you talk about creating this care plan, which basically looks at providing integrated care to the patient or holistic care to the patient, then in those cases, you would generally see that there are going to be some benefits of, working in partnership. That means lots of different types of people can also come together, work. When I say different types of people, I'm talking about nurses, healthcare workers, doctors, consultants, different practitioners coming together, and they're trying to work together to be able to provide this particular service. And then when we talk about, benefits, we are also looking at the benefits of, say, for example, enhanced service delivery. These benefits tend to be because different organizations, different expertise come together. And I give you an example of the NHS website of Wythenshawe Hospital. So the University of Manchester and Wythenshawe Hospital Trust work together because they are looking at providing or collaborating essentially, and then providing the best possible services, because University of Manchester is doing a lot of investment into research and innovation, and that research and innovation is getting introduced as it is being realized into the services at the Manchester Wythenshawe Hospital. And that means that patients are getting, the best and the most suitable services for the illness that they are coming to get treated for. Now, when I say holistic care, when I say comprehensive care, when I say integrated care, it all means the same. So there is a regulation and obviously a clear bit of, policy and guideline within the National Health Service, which talks about the integrated care plan. So comprehensive care plan, integrated care plan, or holistic care is basically the same. So here, whether the services are being provided by NHS itself or is working in partnership with other organizations to provide this service, the care being provided to the patient has to be comprehensive, holistic, and integrated. That means the best possible care has to be provided to the patient, whether it comes by working or using the resources within the NHS or by working with partners to be able to then provide this kind of care. Now, this kind of care would mean care which is mental health care, physical health care related to social and welfare benefits side of things, which would then meet individual patients' need. And all this while, it is kept into mind that this care being provided is also being closely mirrored with person-centered approach, PCA, which is a part and parcel of the NHS Act and how services are delivered to patients within the National Health Service. Now, when we talk about benefits, it is easy to summarize that there are different types of benefits because shared resources, again, taking the example of the Manchester University and Wythenshawe Hospital, there are shared resources and expertise, and this allows pooling in of knowledge, skills from different professionals and organizations working with the University of Manchester and within the hospital. And this can then help leverage the strengths and expertise which are important to provide the best possible care plan or best possible care service to the patient receiving the treatment at the hospital. We are also looking at, let's say, benefits of looking at early prevention or, for example, early detection, because there's a lot of research and innovation being done and research is being carried out within the University of Manchester. So if there are new leads or new areas or avenues which are discovered, then this leads to early prevention and early intervention, because these practices can be directly introduced within the hospital as they are working in partnership with the Wythenshawe Manchester Hospital Trust. Now, on the other hand, if we look at some of the challenges, what could be the challenges? So challenges could be financial challenges, resource challenges. That, as we always say, that there are resources are always finite. In general, when we talk about outside, we talk about today water conservation. We look at protecting our forest and things like. Why do we do this? Because we know that these natural resources are finite. That means they are limited. And in order for us to be able to pass on these resources to the generation, look at the projects which have been started. For example, reduce plastic in oceans. The reason is we want to leave something to our younger generations and the future generations, and it is our responsibility in a way to ensure that less and less plastics enter our river streams, which then means less plastic going into the ocean. So these are challenges which can be which are basic, challenges which humanity is trying to overcome by working together or collaborating in different projects of charity, or with the governments and with international organizations. So when I relate this to challenges within the health and social care sector, in particular, we'll be looking at financial challenges, resources challenges, and these challenges tend to be limited resources such as funding, staffing, infrastructure side of things can be a challenge when it is coming to, providing these services to the members of the public. Now, why did the government during COVID pandemic, make a decision to construct makeshift hospitals in London, Birmingham, bigger cities, is because they saw that the demand for hospital beds and ventilators will increase. So as a bit of proactive thinking, the government started to put steps into place to ensure that if the existing hospital and infrastructure was overwhelmed, then they had provisions for patients to go into these makeshift hospitals where they could receive treatment, and there were enough ventilators available to be able to put or provide it to patients who needed them. So when we look at this aspect of challenge in those, from a point of view of COVID, what we can clearly see is that hospital beds became a challenge as the infections, spread. The shortage of ventilators become a challenge. One of the clear other challenge which came across was that a lot of operations were put into, some sort of a back burner because there were an continuous influx of COVID patients coming through, and they were being given priority to be able to treat first rather than, so a lot of the other operations which were supposed to happen were actually put on hold or were postponed. And this was one of the challenge which, came up during the COVID pandemic. So when we look at challenges of partnership, now these challenges are being solved or these problems are being overcome by NHS working in partnership with some of the private hospitals to ensure that if they are unable to treat the patient and the waiting list is very long, then in those cases, NHS does refer patients to go to a private hospital wherein all the expenses and other bits are taken care of by the National Health Service. And this allows the patients to receive treatment early in order to get better and get well soon. Challenges could be in terms of communication, which is one of the most, let's say the simple challenge which comes up, sometimes information sharing and communication, because of the fact that there are multiple agencies involved. And when you have data protection laws in place, sometimes sharing on information cannot be done as promptly or as quickly as possible. And in those cases, information sharing and communication then tends to become a challenge. Is that okay? So here we will need to identify in this task criteria a couple of benefits and a couple of challenges, keeping in mind a particular situation. Like I've taken the case of COVID, and you would need to explain 2 or 3 challenges and 2 or 3 benefits, and that would help you cover this particular assessment criteria. Now, we look at the second assessment criteria, which talks about how the healthcare sector and the social sector, people within the social services. So when we talk about social services means, social workers, which are, working with the council, childminders, foster, people who take care of, children in particular, are working together with the National Health Service to be able to offer these services to the members of public. So when we talk about the health and social care sector working together, we are looking at they working together and coming to provide and meet some of the complex needs of individuals, not just in terms of their well-being, but also in terms of, some of them having to either receive care or, in some cases, receiving treatment for certain illnesses. So when we talk about how the health sector and the social care sector works together, we are looking at, thinking of things like, coordinated care planning. For example, some of these services need to come together to be able to then look at, let's say, delivering an integrated care plan for the patient, for a particular patient, which is, say, for example, had an accident. Now, if you've had an accident, you would receive first healthcare services. That would mean you'll be admitted to an hospital, probably taken to the A&E, if required, any surgery would happen, or you would be, if you've broken a leg or an arm, just as an example, you will get a plaster and you'll be given some medication and X-ray would be done. So all that is the healthcare sector. Within the hospital, it's happening. Now, at some stage, when you get discharged from the hospital, there's a cast on and you are being given some medication. At some stage, it'll take a couple of weeks to get better. And, in order for you to be back on your feet, then is the part of the social care sector, which comes in, social services kicks in. So, for example, there'll be an occupational therapist or a physiotherapist which will visit you, will help you, do some exercises, get back onto your feet. There'll be support given by the council to be able to ensure that you are able to, say, for example, meet your expenses or, meet your daily needs. And this part of it would be social care services. So when we look at health and social care sector working together, if somebody's had an accident, after that you have to have, it'll take a couple of weeks for you to get better and get back to your feet or go back for the things to go back to normal. Then both healthcare and social work services will have to work together to be able to ensure that you are able to get back onto your feet. And in those cases is what we are looking at is that when we see this working together to deliver coordinated care planning, to look at transitioning happening between, when you're receiving these services from health and social care, and then you're receiving these services primarily from hospitals, rehabilitation, rehab centers, as we call them, or care homes, then this would involve, essentially both the sides working together to be able to deliver these services to the meeting requirements of the patient. Now, when I say rehabilitation and support, the reason I say rehabilitation and support, and by giving that example of an accident, is that at some stage you would need medical treatment, which is happening in the hospital. And then after the treatment has been received, then you are going to receive individual care. And that would be through therapy, maybe social services, maybe a therapist who would come in and work with you to help you get better and get back on your feet. And this is where we would say that these two services work together. So medical side of things, which is coming from health and social care services, and then looking at, for example, therapy, rehab, and say support that you need to be able to get back onto your feet. And that would be the social care side of services. If I look at examining or looking at taking up an example of mental health care service, you would have people who have disabilities, they are physically challenged. And in those cases, your psychological and psychosocial versus mental health services would be provided, by two different heads. And one will be healthcare services, and the second would be the social care services. And they would be essentially, consisting of people who are working as social workers, counselors, or, organizations in particular who are either working or have got established as, social work organizations would be coming together to primarily, deliver this. Now, when we look at the two sides working together, health sector and care sector working together, we see the demand for multidisciplinary teams getting formed. So here, when we look at multidisciplinary teams, we are looking at, both the sides of the teams coming together, healthcare services and social care services, which will be looking at pooling their resources, their expertise, their manpower, their skills, and they would come together to be able to then provide these services to the members of public. And when we look at some of the legislation which works on both sides, when we look at, one is the Health and Social Care Act of 2012, Safeguarding Act, the CARE Act, and the NHS Act. So these 3 or 4 different acts that we've studied in Learning Outcome 2 actually show the joint working of healthcare and social care services under this particular, banner of health and social care, or Department of Health, essentially, and providing these services to the members of public. Is that okay? Any questions on this so far? Okay.
No.
Okay. Now let's look at the third criteria, which is looking at, examples of, best practices that we can see in terms of working, between these two services together. So if we talk about some working examples, I know some of you have been working within the health and social care sector. Can you think of any examples that you see healthcare services and, social services working together? Can you think of some examples? Okay. If not, then let's look at one of the bits that I had picked up in the legislation when we talked about safeguarding. We talked about the multi-agency safeguarding hubs or safeguarding boards which are formed. Safeguarding boards which are formed have let's say representation from the police, the primary care trust, the local authorities or the council, and their aim and remit is primarily to ensure that there is no abuse, neglect, or harm being done to members of public, specifically vulnerable adults or children. Now, when we talk about examples of how both sides come together, when I say both sides, I mean health and social care services coming together. One of the things that we could do quite simply would be taking the example of, Safeguarding Act. And then under that, what we can see is that there's a collaborative approach where health, social care services, education, department, and the law enforcement, which is the police, as agencies, all of them come together to be able to safeguard vulnerable adults, children, individuals. And in this case, they also sometimes take away them from harm's way. That means, one, they're ensuring they're coming together from a law enforcement agency point of view. They're coming together from a point of view of education by giving training and development, and then also ensuring that the people who go out and meet the vulnerable people who receive these services are equipped, are trained, and are, let's say, equipped from a point of view of information and communication, that they are able to then provide these services without causing any harm, or ensuring that harm does not get caused to people in the vulnerable adults or children as a category. And that would be an example of how we can say multi-agency safeguarding hubs, which enable identification, maybe to a certain extent intervention, and then lead to better protection of people when they are receiving support services from local councils or in their area. Now, we could also look at integrated, mental health services. So when we talk about the IM, say, for example, if I say IMHT or S, integrated mental care health services, here I am looking at this particular term and replacing it with something else, is because of the fact that sometimes when we look at working within the health and social care sector, a lot of you could be working within mental health care services. And when we talk about the integration of mental health care services with social services which are required to be provided, that could also form a good example or a best practice in terms of showing how health and social care services come together to be able to provide and deliver this to people who require it at any given point in time. So integrated mental health services would be, across the health and social care sectors, simply because they would be looking at collaborating between, mental health care professionals, social workers. You could also be looking at working with some of the community organizations to help deliver these services to people who are challenged or are mentally challenged. And in this case, these services that are provided can only be provided comprehensively if a lot of relevant authorities come together to be able to deliver these services to the individual. Now, if you also recall that we talked about the PCCTs, which are primarily the primary care trusts. And under the primary care trust, the joint commissioning groups were set up by the government. So when we talk about the JCGs or joint commissioning groups, these are also examples of how best practices can be shared, and then, and obviously services can be delivered by working together. So the joint commissioning groups, which are formed under the primary care trust within England and Wales, they were involved in ensuring that health and social care, provision of services can be done and planned, jointly by local councils, the devolved government, and also taking into account, the National Health Service. Now, this approach basically allowed, these services to be delivered effectively, allocation of resources to happen locally in the local populations, And then this also meant that feedback could come in from people who are in a particular area. For example, Manchester, and Manchester is a big town. So obviously, if I look at, say, Didsbury, Whalley Range within Shaw, or if I look at a particular town like Oldham or Blakely or any other area within Manchester, then we need to be able to look at the joint commissioning groups, because they would be working towards ensuring that these services are delivered in a particular council. So when we look at Trafford Council, Bury Council, Greater Manchester Combined Authority, which is one such council, they would be looking at specifically focus on ensuring that these services are aligned, resources are effectively allocated, and are shared with the relevant groups, both in health and social care, people who are involved in providing these social care services to members of public, and then they are ensuring that these are being used and provided to the members of public in order for them to make use of these services. And that is where you will be able to look at picking up best examples. So in short, if I have to look at picking out best examples of how health and social care services come together and provide various kind of services to the individual, you would need to think of an example here. Somebody who's going back to and dipping into the example of somebody who's had an accident would not just need healthcare services, but at some point in time would also need rehabilitation or rehab services, which could be therapy, which could be physiotherapy, which could be counseling, which could also be, support in terms of benefits, because the person is not able to work, but obviously has a family and would still need to feed his family. So those are the examples that you will need to look at in order to basically cover this particular task. Another example that I could just put it and throw into the basket and mix would be to say, sometimes when you have patients who require, what is called end-of-life care, or for example, they require, some sort of a, I would say care, which means that they are not able to do their daily course, for example, elderly in particular, when we talk about. So when we talk about, say, palliative care would be they need specialized, care from, let's say, set of individuals within the society. So palliative care could be, people who are kind of diagnosed with cancer, for example, or have some sort of a terminal illness. In those cases, you'll be looking at health and social care services coming together along with the local authorities and the community services coming together to be able to provide services of care to the patient. And this would mean that they would receive medical treatment from nurses or a team of nurses, which also visits the person at their home, because they're unable to, if they're elderly, for example, they're unable to travel or drive. And in some cases, their illnesses tends to be, requiring specialist care because of the seriousness of the illness or the, for example, the care which is required. And they would be examples of what I would say best examples of showing health and social care services working together. So palliative care could be one such area that you could pick out. Now, the merit assessment criteria for us looks at explaining the role of learning and development in promoting multidisciplinary teamwork. Now here, if I have to look at what do we need to cover in this particular assessment criteria. Now, when we talk about the establishment of multidisciplinary teams, and they work in collaboration to be able to provide, let's say, care to patients. For example, when we look at talking about multidisciplinary team, you go to the GP surgery, you have a doctor, you require a prescription, you get the prescription from the doctor, he diagnoses that this is the problem, then he or she issues your prescription. Once you get the prescription, you take it to the pharmacist. The pharmacist would prepare the medication and then explain how many tablets or what is the, how would you have these, how would the medication need to be consumed. And after that, what you do is you take it home and then you start the medication. At some stage, when we look at the process of learning and development, what we want to be able to understand is why is this crucial to promoting multidisciplinary work? And why is it that various types of professionals from different disciplines have to collaborate and share expertise in order to, basically make this, let's say make the service available to the patient. So here, the concept of learning and development means you're looking at enhancing the understanding of people who work within this sector. That means they are going to be, this is something that you're going to be looking at training the individuals on, so that they know exactly what they need to do in their role. Now, if I'm a trained nurse, but over a point in time, I've just graduated, I've become a nurse, and then I start, I get a job and I start, working within that particular hospital. Now, over a point in time, what will happen is that there are new policies, procedures, guidelines being issued and are coming up. And this is where I would need to keep myself up to date with how these guidelines, regulations are actually affecting my role. You would also need to look at if there are new equipments or new, let's say a procedure is rolled out in the department, and a new equipment has been introduced, then you would also need to get training on that new equipment to be able to, let's say, work with that equipment, but also being able to draw meaningful references which are required for you to be able to tabulate into a report. If the customer has had, for example, in this case, a patient would have had an X-ray, and the X-ray scan would need to then be interpreted and would also then be put into context in terms of how it is related to the treatment plan which the patient has. So in those cases, you would generally see that you would need training and development from your organization, and in some cases, this training and development would be required regularly. And reason why you would require it regularly or regular intervals across the year is because you want to keep your knowledge, your skills up to date and current. And there are no, instances wherein you either do not have information or have to depend on in getting hold of this information from others. So in those cases, we will need to look at ensuring that the learning side of things and the training side of things continuously happen within the organization. So here, good leadership is important, because if the organization needs to remain current with the compliance, meet all the regulations, let's say a hospital, you have lots of different types of compliances you need to maintain. Health and safety, for example, compliance for ensuring no infection spreads. You're looking at various other compliances in terms of data protection. And these are, to name a few that I can think of, will need to be maintained and always be up to date, because they are related to health and safety of the individuals working within the organization. This could be health and safety for the patients as well. So in those cases, what we are looking at is a lot of staff would be undergoing treatment to understand how to handle personal protective equipment, how to handle the usage of a particular type of machine, how to look at ensuring that data is safe when you log out or when you move away from your desk or station, you log out from your PC. So in some cases, you would see that nurses, doctors use a swipe card across a PC. The moment they swipe, the PC gets locked and nobody has access. No third party or no visitor can get access to the PC or the information. So these are bits which are required to be done in order to ensure that, training and development has to be done. And that training and development which is done is related to your specific role. And you are then using that training and development to implement and to basically provide your services or deliver your roles and responsibilities when you are providing care to the patient. So here, the idea here is in this particular assessment criteria is we need to be able to identify what is the role of learning and development in promoting, multidisciplinary work. And when we look at the role of learning and development, we need to be able to take an example, and that example would help you put this across. One of the other bits which I would mention, would be that one of the other bits that I would mention would be sometimes you see trainee nurses, essentially, working with the senior nurse, or maybe junior doctors working with, consultants and, doctors within their department. And this is being done to train them to handle and understand some of the best practices which are required. And sometimes training in the form of mentoring and coaching can be far more effective, than essentially, undergoing a lot of training. So you would generally see shadowing, training, or mentoring happening in order for the working or promoting or multidisciplinary working within the hospitals and within various departments within the hospital. So this particular criteria would be looking at taking best examples of how different roles could benefit from the process of training and development happening within a particular health and social care setup. So, for example, a hospital, for example, a surgery, or a community center, or a pharmacy, or a care home in this case. And that would be useful for the purposes of understanding this assessment criteria. Any questions on this so far? Okay, so and the distinction criteria primarily is focused on assessment. So we need to do some analysis and assessment on what could be the potential consequences of, partnerships not working. So here, so far in the discussion on the learning outcome, what we've done is we've discussed a lot of things in terms of benefits of, partnership working. But if partnerships do not work, what could be the disadvantages? If partnerships, break down, for example, coordinated working between partnerships breaks down, then what will happen? Or in those circumstances, how would that be detrimental to, looking at, providing of these services to the members of public? So when we look at that in particular, here we are going to be discussing, when something breaks down, when communication breaks down, when joint working breaks down, or, when, for example, a literal example is, if sometimes your Wi-Fi in the house switches off, what happens? There is chaos. Everybody says Wi-Fi not working, this and that. So similarly, if you apply that concept of, if things do not happen as planned, or if they are not happening as they have been described in policies and guidelines, then what could be the disadvantages or potential consequences of partnerships, in this case within the health and social care sector, not working? So some of the things that we can think of would be things, for example, if partnership workings breaks down, that means if there's distrust, there is no trust between two different agencies, then you're going to see fragmented delivery of services happening to the patient. One will blame the other will blame that, okay, this is not my work, this is something which has to be done by somebody else. And there would be an essential case wherein the things would not happen, as they are planned. And that would mean patients will have, their care would get affected, or there'll be poor outcomes as far as patient care is concerned. Sometimes it could also lead to increase in costs in terms of partnerships not working. That means duplication of work is happening and duplication of services is being done. The same bit could be that, say, for example, if people do not understand that when they need to go to A&E, that could mean unnecessarily hospital admissions. It could mean, say, for example, occupation of beds, which could have been better utilized by other patients. It could also mean that sometimes if people fail to, diagnose certain things, or, for example, problems properly, then it could also mean that in some cases, it could hold up capacity of, beds within a hospital. And this could also lead to, for example, poor outcomes in terms of patient care. People who actually require care would not be getting it because there's a breakdown of communication in terms of, okay, if you go to a GP surgery and the GP surgery essentially refers, for example, you to go to A&E or get some tests done. But if the surgery fails to, respond to that, okay, blood tests could have been done, or other various tests could have been done for the patient, and the patient is not showing any signs of any significant, let's say, effect to its health, then in those cases, you could generally see that it could lead to what is called inefficient care being provided by the GP surgery, wherein they're passing the buck on to the hospital to say, okay, you need to go to an A&E, you need to go to an hospital to get this checked, or, instead of that being checked within the, surgery itself. So that is where what you'll generally see is that in some cases, it could lead to potential consequences in terms of poor care or poor services being provided or lack of holistic services being provided. And in some cases, it could also mean missed opportunities, which means that, sometimes if there is a breakdown of communication or breakdown of information not being shared properly, then this could lead to poor outcomes. When I say poor outcomes, means misidentification or not detection of early symptoms of any sort of a disease which the patients could have, and that could have fatal or potential consequences towards later time when they're diagnosed. Sometimes we get to see, and read stories and hear about it in news that, patients, for example, in some cases, what patients, we have seen in the past on the news, patients have complained that, proper tests were not done. And because if these tests were done properly, then, my dad could have survived, or say, for example, somebody in my family would have not been diagnosed with this if the early symptoms of that were picked up. Now, that is where we see partnership working breaking down within the health and social care sector and health and social care services. And if these are not working in terms of picking up the early signs of what could lead to, for example, in this case, a cancer or a prostate cancer or some sort of a cancer, and then being fatal in the future, then this is where we see the lack of holistic approach or missed opportunity for preventing and picking up that particular disease because of lack of training, miscommunication, or lack of communication in general, and procedural help being provided to the patient at that point in time, which later on can become fatal because the patient's condition has deteriorated. And that means that at some stage, this particular treatment might not give all the benefits which is required for the patient to recover. And in those cases, we see failures of potential partnerships, and that is what needs to be covered in the assessment criteria 3D1, which is a distinction criteria. So here you would be looking at taking an example of a particular type, and that would mean that, with that help of that example, you'll be looking at explaining why this could have a consequence, which could be a severe consequence for providing services to the patient. And I've put some points in things like lack of communication, lateness to work. For example, if the services start half an hour late, what could be the potential, consequences of this in terms of, pharmacies opening up late, for example, or if, say, for example, sometimes when we have walk-in surgeries and patients are unable to get through and they are then, asked to take appointment the next day, or, look at taking appointments with the A&E. So various examples you could think of. You have to think of creatively some examples here that you will take up and then explain the consequences of partnership not working. So this brings us to the end of this particular learning outcome. Any questions at this stage from anyone? So have we understood, the learning outcome 3, which is focused on understanding the importance of multidisciplinary teams and partnerships, which is the crux of the learning outcome 3 and some of the assessment criteria that we've covered?
Yes, sir.
Yes. Any questions at this stage? Yes, go ahead.
No, we have any kind of
Right. So what you have to look at is, if all of you then look at, Moodle in particular and go into your course after the session, what we are looking at is basically going through this particular presentation that I've discussed. But in tandem to that, what I would also suggest is to look at reading a particular handout, which I'll show you right now, which is up on Moodle. And this particular handout is going to be quite useful, primarily, which talks about this LO3 handout and the multi-agency working models, which is the theoretical frameworks that you need to cover. And this handout LO3, which will give you a bit more understanding in terms of what is multidisciplinary teams and why partnerships are important, as far as health and social care sector is concerned. So this particular handout is about a 15-20 minute read. And what I would suggest is it covers these two concepts of multidisciplinary teams, MDT, and partnerships by taking a few examples in terms of activities. And I would suggest that this will be good for you to go through and crystallize on what we have discussed today in today's learning outcome. So this handout, in tandem with the presentation and the discussion that we have done, should help you comprehensively understand the importance of MDTs and their working within the health and social care sector. Tomorrow's session is going to be focused on discussing the assignment brief for this unit. So we will start at 11, and obviously we'll discuss how to put together and compile the evidence for this particular unit. Is that okay?
Yes, sir.
Yes.
Good stuff. So thank you so much for joining in, and I will place a copy of this recording, shortly just after the session onto the WhatsApp group, and you should be able to go through if you need to revisit anything that we have discussed today.
Okay. Thank you.
Brilliant.
That's
Thanks for
fine.
joining in, and I'll see you tomorrow. Bye for now.
Thank you.
Thank
Thank you.
you.